So today I just want to talk to you guys about how hard medical school actually is. It's one of those questions that a lot of pre-med students have, a lot of non-medical students have, and hopefully by the end of this vlog, I'll be able to share some light on that. So the goal for today's vlog is just to show you guys some of the challenges that I faced and that you may face as first-year medical students, and as well as some ways to overcome those challenges. So hopefully you'll be able to use some of my advice and it'll help you in your everyday studies, everyday life. So the top 3 things that I think make medical school challenging, I won't say hard, challenging, is the volume of information that you're expected to learn and master, adjustments, and how to manage stress. So just a little background on myself. I did my undergraduate studies at Louisiana Tech University in biology and my graduate studies at the same school in molecular science and nanotechnology. So I have the typical sort of med school story, studied a few hours per week, made pretty good grades, and I was cool. However, if you study for a couple hours per week in medical school, you're probably going to get dropped like a hot potato.
Drop like a hot potato.
For real. Nah, but seriously, in medical school, the volume of information that you're expected to learn is crazy when you compare it to that of undergraduate classes. So you may go from studying 3 or 4 chapters per test to becoming a medical student and having to study 35 to 40 chapters per test. And some people find that challenging, and it takes a little bit getting used to. To overcome the challenges of volume, I do a couple things. For one, I utilize my time management skills by creating checklists. This allows me to check off anything that I need to get done by the end of the week. Secondly, I like to decrease the amount of outside resources that I use. When you're in medical school, time is one of your greatest assets. So using a bunch of outside resources that some of your friends or people may recommend to you, you might not be able to do it because you won't have enough time. So sticking to lecture notes as well as a few outside resources is key. So the second challenge of becoming a medical student is the adjustments. And when I say adjustments, I mean adjusting the way that you think. So at this stage in your academic career, you can't just think first order anymore. You have to be able to think second order, third order. I don't know if there's a fourth order, but if there is, you have to be able to think that way. So I just want to show you guys a quick example of an IMCQ question that shows you how you have to think as a medical student. A 49-year-old man is brought to the emergency department because of fever, skin flushing, and an altered level of consciousness. He has a 5-year history of poorly controlled type 2 diabetes mellitus. His respirations are 36 per minute, pulse is 120 per minute, and blood pressure is 60/40. Blood culture is positive for E. coli. Which of the following bacterial factors is most likely responsible for this patient's current condition? So if you chose C, lipid A, then you're correct. I won't go into explaining all the details of this question. I just wanted to use it as an example to show you guys some ways that you'll be expected to use second order and third order thinking. One of my favorite ways to adjust to higher order thinking is to break down multiple choice questions. I look at the clinical scenarios in the STEM as well as the answer choices. I figure out which answer is correct, why it's correct, and why the other ones aren't correct. I feel like this is the best use of time. So the final challenge of becoming a medical student is learning how to manage stress. And this really depends on the person. So for me personally, I like to work out, play basketball, vlog, cook. And this allows me to de-stress and take a break from all the studying that goes on. And it keeps me fresh, it keeps me motivated. So those are my top 3 challenges when it comes to being a medical student. I hope you guys enjoyed the vlog. Make sure you hit that subscribe button. And if you have any questions, any comments, or any content that you want uploaded, make sure you drop it down below in the comment box. See you guys next week.